Hello, you're welcome to the Cycle Direct podcast, the podcast that keeps you informed about the daily health issues affecting Nigerians. I'm Brian Imadia, and today I'll be talking about the top 10 common diseases affecting young adults in Nigeria. Now, young adults are the backbone of every society because they are full of energy and they've got a lot of potential. But even in this vibrant stage of their life, health issues can arise. A lot of young people feel like they are untouchable, their bodies are like steel, but they can fall ill. And that's just the truth because we're as fragile as you can get, even when we're young. So some of the diseases that occur with young people are preventable, while others may require a proactive management to deal with them. So let's explore these diseases, their impact, and what we can do about them. Now, because the video will be too long, we're going to take 5 diseases today and take the others in the next video. So we'll be kicking off with a disease that nearly every Nigerian know too well, and which is malaria. Malaria still remains one of the most common diseases affecting young adults in Nigeria. Now, according to a study published in the Journal of Preventive Medicine and Hygiene, the prevalence of malaria among young adults and children in Nigeria is alarming, and it ranges from 16 to 46% across various age groups. Now, that same study found that the prevalence of malaria was higher with the older children and young adults, with about 46% of the children between the age of 15 and 17 testing positive to malaria parasite. In contrast to very little children under the age of 5 that had an incidence of about 16%. Another report by the WHO estimated that we had about 68 million cases in 2001 that resulted in 194,000 deaths, especially in the north. Now, malaria is still a big head burden in Nigeria. Malaria is caused by a parasite transmitted through mosquito bites, and it can cause symptoms like fever, headaches, and it can really, really disrupt your daily life. But the truth is, and the good thing is, malaria is preventable. And if you clean your environment very well, you use insecticides, and you clear off water pools, it can significantly prevent the spread of malaria. And for individuals that already have the disease, they can take an anti-malaria drug to deal with the disease. The next condition we'll be talking about among the top 10 conditions affecting young adults in Nigeria will be high blood pressure, or what is called hypertension. Now, hypertension is what many would consider as a disease that affects majorly older people in our society. But you'll be alarmed, you'll be shocked at the growing prevalence of hypertension among young adults in Nigeria. Now, there's no study that gives a clear-cut prevalence among young adults in Nigeria, but in a study conducted in Enugu, published in the Nigerian journal, medical journal, the prevalence of hypertension among young adults between the age of 18 and 40 was 21%, which is massive. In that same study, it was found out that hypertension was more common in urban areas versus when compared with the rural areas. And that speaks of lifestyle, as people in the rural areas are more active than individuals living in urban areas. Hypertension can occur as a result of several lifestyle factors, which includes one, stress, unhealthy diets, smoking, sedentary lifestyle. And if you find yourself in the negative of any of those, you've got to begin to act and act on it quickly, because hypertension is a silent killer, and I mean it. And if left unchecked, it can lead to several heart cardiac diseases and stroke and even death. That's why you've got to do regular blood pressure checks. You've got to change your lifestyle. All those things are very, very essential in dealing with hypertension. The third disease that we'll be talking about that affect young adults is HIV. It's been there a long time. But the bad thing about it is that it's now growing in alarming rates. In a study, it was estimated that young adults in Nigeria between the ages of 15 and 24, it was estimated that 4% of young adults in Nigeria between the ages of 24 have HIV. Now, this is shocking because, it was steady at a period. It means that there's a whole lot we still have to do. And it is also worth noting that the adolescent population in Nigeria is about 31% of the entire population. Now, considering that Nigeria is about 230 million people, estimated, we're not so certain, but estimated, that means we're talking about around 3 million people, young adults, that have this condition. And the transmission is majorly through unsafe sex, limited access to preventive tools like condoms, and poor advocacy, education, and awareness. But there's a good thing that came some many years ago was the introduction of AROTs, the antiretroviral therapy, and it really transformed the management of HIV, made it into a manageable condition. But again, early testing is essential, and education is also very critical in dealing with HIV. The fourth condition we'll talk about is gastroenteritis. And this is what is commonly called food poisoning or stomach flu. It is caused by various factors, including the bacteria, viruses, and parasites from contaminated food and water, and it causes symptoms like diarrhea, vomiting, abdominal pain. Now, the prevalence of gastroenteritis among young people is majorly influenced by poor hygienic practices and limited access to clean water and poor sanitation. So, dealing with this, we got to ensure that the way we prepare our food is more hygienic, and we got to ensure also we take clean water. That's a challenge. It means you got to invest a bit more because potable water is not available to every Nigerian even till today. For individuals that have this disease, you got to stay hydrated, and you got to ensure that everywhere is clean to prevent reinfection and ensure that the condition is taken with utmost seriousness as it requires. The fifth disease that I'll be talking among the top 10 diseases affecting young adults in Nigeria is tuberculosis. It's been there a long time. It's been a health challenge a long time. And it affects individuals living in crowded areas and urban centers. Now, it's spread through the air. It affects primarily the lungs, and it causes symptoms like persistent cough, night sweats, and weight loss. Now, there's a problem of co-infection with HIV that's worsened the management of the situation, and that's one area that we all need to really look at. In 2020, there's a report that estimates that the tuberculosis cases in Nigeria was 452 with 138 diagnosed and notified, which means that there's a gap in the diagnosis and identification of the disease in the country. Is another area that we need to really look into. Now, there's another report by the National Tuberculosis and Control Program, and it reports that the incidence or the prevalence of tuberculosis is highest with individuals between the ages of 15 and 34 years. And this is big because these are really young people. They are supposed to be the movers of our society and our economy. And that's why we've got to take this very, very seriously. Now, but the good part is that tuberculosis is largely treatable with persistent or consistent medication, and that's the good thing about it. So, what can we do to address this challenge? First is awareness. You got to know these diseases and their symptoms and the interventions that you can carry. Another thing is you got to ensure, number two will be prevention. Now, meaning that one of them will be change your lifestyle. You got to do routine health checks, and vaccinations can play a role. Lastly, we've got to keep advocating for access to healthcare for everybody, and particularly also the young people in the country, as that is still a major challenge in our society. So next time, we'll look at the other 5 health conditions affecting young adults in Nigeria. Remember, your health is your wealth. If you have questions and would like to share your story, reach us by dropping a comment. Thank you for tuning in to the Circle Direct podcast. Stay informed, stay healthy, and take charge of your well-being. Until next time, signing off.